So I'm Kara.
And I'm Melissa.
And today we're going to be talking about private practice, particularly with an LMHC. So we'll start off with pros and cons of being in private practice. So as far as the pros, you have much more autonomy and freedom. You are your own boss. You can also potentially make more money, and you can also actually qualify for specific tax deductions. For example, you can get a self-employment tax deduction. If you work from home, you can get a home office tax deduction. If you don't get health insurance through like your husband or partner or wife or whatever, you can also get tax deductions for your health insurance premiums, and also tax deductions for any education that you seek as well to support your practice. You also get more of an ability to specialize. When you're in community mental health or you're working for someone else, you kind of have to take the cases as they come. However, once you have a private practice, you can really decide what clients, what disorders, what specialties you want to focus on, and make sure that you're really attracting the clients that you're qualified to treat. Since you're your own boss, you have no company meetings. I know a lot of people look forward to that. And again, since you're your own boss, you can really decide how you want to control your work-life balance. Not only do you get to set your own hours, but you can also balance your caseload and your hours however works best for you. If you know that you're seeing someone who is very tiring, you can organize your week as such so that you're seeing them bright and early when you're ready to go, or at the end of the day so that you can just lay back and take it easy after this client if you know you'll feel tired afterwards. You can also potentially eliminate a long commute because you get to choose where you put your practice. If you have a practice attached to your home, you don't even need a commute. So that can also add a lot to work-life balance. And in addition, you can also select whether or not you want to do private pay if you don't want to have to deal with insurance companies. As far as the cons, since you are self-employed, you don't get benefits supplied to you by your employer. So this means that you'll have to be responsible for finding and paying for your own insurance, liability insurance, continuing education credits or units, as well as your own 401k. You won't have an employer contributing to that. You also carry more liability. You don't have an agency that has their own, compliance and legal team that are always there to fall back on if something goes wrong or if you have ethical questions. That's up to you. You need to have your own consultation and your own, liability lawyer on retainer. In addition, a lot of clinicians in private practice report that it can be isolating. You don't have water cooler chat anymore. You have less availability of consultation and support, and you really need to seek it out yourself when you need it. There's also financial instability. There's always an inherent risk of owning your own small business because you don't have a guaranteed paycheck. You're essentially a fee-for-service clinician, but you're responsible for gathering your own caseload. So I like what one clinician said. They said, "I've never starved, but there have been more times that I ate more peanut butter." In addition, you also have to remember that you need to save for your own taxes at the end of the year. That's not going to be automatically taken out for you. And while on one hand, you have less agency-specific paperwork, you also get more paperwork in other places because you're now responsible for taking care of your own appointments, your own insurance claims, receipts, credit card payments, or credit card paperwork. So there's a lot of other paperwork that can come along with running a private practice that you don't have to think about when you're in an agency. In addition, building a caseload takes time. This also factors into that financial instability that you won't have a full caseload right from the get-go. And a lot of people find that they have to stay at their regular job and work part-time in their private practice while they build up their caseload. There's also all of the other responsibilities that come with running your own business. It means you'll be wearing a lot of hats. Not only will you be the clinician, but you'll also be responsible. You'll be your own marketing department. You'll be your accounts payable department. You'll be your own reception. You'll be your janitor. You might be cleaning bathrooms, or you might need to hire help to fill in areas where you just don't have the knowledge. For example, hiring someone to help you build your website. or hiring someone to help with reception needs if you don't have enough time. And this can also mean that you have longer days because you're filling extra responsibilities. So, and as well, being your own marketing department, you need to get comfortable with self-promotion because it's the only way that you'll build your caseload. I liked what one clinician said. She said, not only am I a counselor, I'm also an accountant, secretary, janitor, medical records clerk, errand staff, checkout counter, manager, business owner, marketing professional, brochure writer, logo designer, and bill collector. So there's a lot of exciting things that come with private practice, but it does come with more work as well.
Okay, so these are business considerations, and Kara's gone through a lot of them. But when starting to think about having your own practice, the first thing that you're probably want to do is create a name for it. And this can be really good, especially if you like to be creative. I mean, so a lot of people will do the like average, like just their name and then like counseling or whatever, and just attach their name to something for business. But this is also an opportunity for you to get like really, really creative with what you would like for your name to do and how it would be represented within the community. And it's also important to create a name also for, and I'll go through it down the road, for licensing and like the business entity purposes. So the next part is to figure out within your state what type of business entity you would like to be and what is allowed. So particular states will not allow you to be a certain entity. So you have to know the law. This is where having someone to talk to or a resource to go to will be very, very helpful. But I believe Massachusetts, you can do for LMHC or private practice, you can do LLC, you can do an S Corp, you can do a corporation if you want. However, LLC is probably the best route to go for tax purposes. And that's really the difference between all business entities, is just the tax purposes and how your taxes flow. And then also like when the business dissolves, if you're paying upfront or behind the scenes for income. So there's just a lot of little different nuances between them. LLC allows you a little bit more flexibility, but again, it's what works best for you. And then licenses. So license, your professional license is one big one that we all kind of need. And then any other extra licenses that you think that you might need to be able to fulfill the practice and what you want to do. And then licenses within the state, anything that you might need to build your practice and make sure that you're accommodating to the state requirements. Then you also will need insurance. Kara will talk about this a little bit more down the road, but medical and dental, you'll need to have your own. Companies don't have it for you. You'll need to think about if you're going to take insurance for your clients' insurance and how you're going to deal with those. And then also you're going to need to have your own liability insurance too as well for like malpractice. The next step is an exciting one. You can think of the location that you want to be in. And do you want to be in a city? Do you want to be in a town? What kind of building do you want to be in? And then that also comes into terms with your office space. A lot of people will sublease to start because it decreases the overhead, but then you also could lease a space, a small space or a larger space, or you could even look into even owning something. Or if you're in that position down the road where you like a family, or you have a piece of property where you could turn part of it into an office, you already own it. You could be creative that way. The next big part is to join professional associations and networking. This is big because you don't have the opportunity with like outpatient or inpatient clinics that already have those connections for you. You need to start creating these connections to be able to help market yourself. And even clubs or even doing community service, where you're out there, your face is out there, you're representing your business, is a great way to just to get your name out there. And then obviously professional associations, joining in on meetings, and just getting involved in the community overall. Slides, please, Kara. If you could, yep, perfect. So then the next one is, and Kara mention this, you need to consider the fact that you are going to be isolated from others. And are you okay with that? A lot of people, although you can talk to people on the phone and you are talking to people all day long, you don't have the time to, like what Kara said, have like that, like coffee break, or like go to like the water cooler and like talk to people really quickly or run something by them. You are on your own for the most part. And people, you need to know yourself well enough to know if you can mentally handle that. You also have to plan for your fluctuating income, up and down, like taxes, all of that, and save for those rainy days. Think about all those LMHCs or people in private practice, although it kind of soared over time during COVID. Think about the people in the beginning that didn't have telehealth or any of that. Everything kind of plummeted. So they needed to be able to have those extra resources to get themselves through until they were able to implement telehealth or whatever and get their clientele back up. And now they're probably all overwhelmed, but in the very beginning, they probably were not. Setting up bank accounts, straightforward. The next one is policies and procedures. What does your business, your LMHC, your private practice want within the office? So policies and procedures can be something as simple as, how people are going to wait in a waiting room, or policies with payment due at the time of service. When is a reasonable time for you to get back to them? Some people might say it's within 24 hours. Some might say it's within 48 hours. I mean, there's so many different nuances to policies and procedures and how you are going to effectively run that and how you're communicating it to your clients. And you also need to be able to think of service and your different accommodations that you're offering, and set those in stone too. So your hours, so that know that you are available these hours. And if you don't have clients later on in the evening, if you are having special late hours on certain nights, you can go home. But making those and setting those up and setting up them up front allows you to be able to manage your personal life and set up for better self-care. So if someone says, hey, could you do 9 o'clock, but you end at 8 or 8:30, you can say, unfortunately, we ended 8:30. I can't. And be able to be okay with that, instead of setting yourself up with being flexible at the beginning and then having to be more rigid down the back end, because that can be a little bit more difficult. And then telehealth, is that something you're going to do? How are you going to implement it? You need to learn how to track your clients' schedules, and also your expenses. So QuickBooks, or if you're not getting an accountant or someone to help do that for you, there's lots of different software programs out there that can do a whole lot of all of it for you, that it makes it very easy in this day and age, but still it's something to consider. And then you obtain your tax ID number. So that's federal. So once you create your business, you will then register it federally, and you also register it with the state, and federal will give you a tax ID number, and that will be used for your accounting purposes. And then a national provider identification number. That's if you are going to be taking insurance from your clients, that you'll need to be able to use that for Medicare purposes. And then the next slide.
I'm trying here. There we go.
There we go. So then I'm just going to read through these very quickly, because it's kind of all self-explanatory. Your expenses would be license renewal fees, your professional association dues that you might have, your taxes that you need to pay. And quickly, I'm going to say upon that, because there are accounting services, one of the last ones on this. And with accounting services, there's one thing that if you're worried about those taxes and what they're going to be after your first year, or you can anticipate making a certain amount of money, your accountant, if you have an accountant that will do it for you, you can pay estimated taxes. And it's based off of your previous year's income. So they can take an idea and say, okay, well, you might be growing 5%. So let's do a projection, or base it off of just what you made last year, thinking that you're not going to grow that much more. And they will estimate how much you should pay for tax and federal, so that way you're paying it 4 times throughout the year. and you're not worried at the very end of the year being slammed with all these taxes and having to like take out a big chunk of your money. So that's something that you can do with accounting services, or even try to figure it out on your own with just the calculations. But it's something you still need to have the money for, because they're not just taking it out automatically, like Kara had said earlier. Professional supplies, so business cards, intake forms. Is it going to have your logo on there? There's so many different professional supplies. Your assessments, all of your measured assessments, you need to be able to have all of that money to be able to utilize that. You need to be able to have access to it. And then how you're going to record and document everything. Are you going to be doing electronically? Are you going to be writing it down? Do you have a safe place to lock everything up so that it's compliant? And making sure that your system is HIPAA compliant. If you're going to be taking credit cards, you need to be able to set up with a payment processing company. There are a lot of local ones, there are international ones, and they just take a certain percentage off of each credit card. So just find a better rate is basically what you have to do. But there's that you have to take into consideration. And once you get it up and going, it's pretty straightforward. Then furniture, office supplies, utilities, marketing again, your website, advertisements, how you want that to look. And then tax services and billing services. These are all the different services that are out there, legal consultation and accounting services.
Okay, so as we mentioned, one of the cons of private practice is that you have to think about liability because there's no one to fall back on anymore once you're in private practice. So some things to think about are things that can create more liability. Having high-risk clients means that you carry more liability. So if you have clients that are suicidal or homicidal, who have more medical issues perhaps, or who are actively psychotic or have more access to, from the old DSM system, diagnoses, these are things that will potentially create more liability for you. Another thing to think about is that we are all mandated reporters, and when you are in private practice, that's no different. So if you fail to report abuse, then that can create liability for you. If you have a client who is suicidal or homicidal or self-harming, the safety planning that we're responsible for is always important, but is even more important as a private practice clinician, because if a client does, heaven forbid, do something, that falls back on you. Same thing with duty to warn if you have a client who's homicidal or is intending to hurt somebody. In addition, misdiagnosing can create more liability, as well as just ethical blunders, both the obvious and the more fine-tuned, and providing ineffective or appropriate treatment. Something to remember is that clients can sue for any reason. The APA reported that about 2% of psychologists face malpractice suits at some point, and about 40% face state licensing board complaints. And the average cost of a mental health malpractice lawsuit in 2014 was almost $47,000. So it's very costly. So it's something to be very careful about. So one thing to consider as a private practice clinician is getting malpractice insurance, which provides legal help in the case of malpractice cases. It can also help prevent lawsuits by, consorting with the client who's threatening to sue and seeing if there's anything that can be done to prevent them suing. They also provide coverage for lawsuits, those very costly $47,000 average lawsuits. And some can also help with licensing board complaints too, depending on the malpractice insurance that you get. The cost of malpractice insurance is dictated by several different considerations. One is the level of risk that you carry in practice. This goes back to not only your experience, but also the clients that you carry, as well as if you have a history of licensing board complaints or malpractice suits in the past. The desired coverage level, of course, changes the cost of the malpractice insurance you'll be paying for, as well as the state that you're practicing within, because different states have different levels of leniency for liability when it comes to clinicians. Think about the differences that we learned about between states in our ethics class when it comes to duty to warn. So a general liability policy with a $1 million claim limit will range from about $350 to $1,750 in annual premiums. And it's also important to remember that some professional organizations, such as the APA, can provide discounted coverage for malpractice insurance. In addition, there are things that you can do yourself to limit your liability. Obviously, we have a responsibility to practice ethically no matter what. It's also important to practice within your areas of expertise. Like we said, one of the pros of being in private practice is that you can really market your practice and only accept clients that fall within the services that you're able to provide. Consider the risk level of the clients that you're accepting. If you're passionate about working with high risk clients, then that's wonderful. And honestly, we need more clinicians like that, and I admire you. But if you're doing that, you might want a higher level of liability insurance. It's also important to get consultation whenever you have ethical concerns or questions about the treatment that you're providing. Find someone that you can consult with. One thing that was also suggested that was interesting is to consider making audio and video recordings of sessions, of course, with the client's permission, to be available to both yourself and the client. They suggested this because, one, it can aid in clearing up confusion about anything that happens between you and the client. It's important to remember that therapy, especially for the client, is a very emotional space, and high levels of emotion can create difficulty in remembering exactly what happened. So if there are concerns from the client about something potentially inappropriate happening, or you saying something that just didn't come off right, and you feel that they're not remembering it accurately, you can pull up the recording and go back through it to see what really happened. It can also be helpful for the client too, to refer back to remember the gains that they made in therapy and the skills that they're supposed to continue practicing. But of course, this is, individual to each clinician and client's level of comfort. So the next thing you need to think about is building a client base. Like we said, you won't have a client base right from the get-go. You have to find those clients yourself, and you can't poach those clients from your previous organization. So one thing that's really important to do is to find your niche, figure out what kind of treatment you want to provide, what kind of client you want to provide that treatment to, and what kind of diagnoses you want to treat. And something that you can do even further is to find your niche within that niche. So, okay, you want to work with people who you have relationship issues. Okay, maybe you're a divorced man and you want to work with other divorced men in that process of grieving and going through the system of, figuring out who gets the kids when and everything like that. So you can really niche within your niche, and the more you can niche yourself down, the better. Once you figure out what kind of client you want to work with, cater your advertising to that ideal client. So if you know that you want to work with young adults, your advertising will probably be pretty different than if you want to work with elders, with people in their 60s, 70s, 80s. You're probably going to advertise differently. Regardless, it's important to build a strong digital presence. Make sure that you work on your SEOs, that you optimize your search terms so that you're showing up when people are searching for therapy in their area, and think about what search terms you would use if you were searching for therapy in your area for whatever it is you're going through. You want to have a good website that's attractive and informative. And you also want to make sure nowadays, especially, that it's mobile friendly, that it comes up well when someone's searching on a phone, because a lot of people will be. It's important to get engaged on social media, as many social media outlets as is appropriate for your ideal client base, and make sure that you're directing all of that engagement back to your website. You can also get involved by having blogs or sending out newsletters. It's important if you're doing newsletters to have an opt-in option on your website that pops up with appropriate timing, because no one wants to go to a website and immediately be assaulted by a, "Do you want a newsletter?" And you also don't want to send newsletters to people who don't want them. In addition, it's important to make yourself profiles on online directories. For example, the APA website and Psychology Today have really great therapist finders that many people use. So you want to make sure that you're available on those and that you keep your profile on there updated. Going a little bit outside the box, you can also accept speaking engagement and interviews so that you can get your name out there. If your church or your school asks you to do a speaking engagement, consider it, because that's a good way to get your name out there. You can also sign up for a website called Help a Reporter Out, or HOPA, or Help a Reporter Out, HAPO. And this is where you'll get emails when there are reporters who are looking to write an article on a specific topic, for example, mental health during the pandemic. And you can decide, hey, you know, I'd love to give an interview to this reporter, and of course do so ethically. But it's another really good way to get your name out there and get some exposure. Build your referral network. Talk to churches in the area, schools, teachers, PCPs, and really start to get a referral network going. In addition, talk to other therapists, because if you have clients that are coming to you who, you know, have an area that's outside of your expertise, you can refer them to another clinician and vice versa. We can help each other out. Have business cards, give them to everyone, leave them everywhere. And also consider using local advertisements, particularly if you're catering to an older population. Put an ad in the newspaper locally. And then, like Melissa said, get involved in your community. If you're looking to work with kids, sponsor a local baseball team. If you're looking to work with adults, get involved in your local community mental health fair or do some community service.
Okay. So you guys are all probably watching this and wanting to jab your eyes out because there's a lot of information. So let's have a little bit of fun. And if you have a pen handy, you can do this. Otherwise, you can do it in your mind. And this is specializing. So what Kara was saying before, like just find your niche or niche within your niche. So we're going to just go through the steps very quickly. So the first thing you're going to want to think of what distinguishes you from another therapist? Why would people be coming to your practice? You need to first think about your population. So do you want to work with individuals, families, couples, groups? So take a second and think about it. I'm going to give you 5 seconds and then we'll move on to the next one. What do you want to do? Like really think about it. Okay, number 2, what is your age range? And if you don't know, like what your age range, so like me personally, I love working with children, but I also love working with the elderly. So which one do I really want? Well, I'm able to get rid of everybody in the middle. So anyone over the age of 18 and under the age of 70, I don't want to work with you. Like you can get rid of certain populations when you're looking at your age range if you don't know exactly where you want to go, and that's a good way to start. So who do you want to work with? What is the age range? Write it down. And then the next one is your diagnosis of the different functional problems. So within the DSM, what are these diagnoses that you really want to specialize in treating? Is it depression? Is it anxiety? Are they personality disorders? What is it? And then you also can think of other different like dysfunctional environmental problems. Working with a population of people that like the LGBTQ community or culturally diverse people. Is it someone that are like immigrants or, you know, people that are having acculturation issues? So you can really, really tailor this to, or like Kara was saying, divorced fathers. There's a lot of different things. So take a second, we'll do another five seconds or so for you to just write down what you would want to work with. Okay, time's up. Last one, modality. And I'm gonna read these off. There's some in here that are really funky, and Dr. V is going to be shaking his head when he's listening to this. So we're gonna go through a few of them and think about what modalities that you're gonna wanna work with. Obviously, we all wanna do CBT, but there are some others out there that you might wanna kind of throw in there to have a larger scope for your practice or a better repertoire of what you're working with. So if a particular type of modality isn't working, you can pull in something else. And also keep in mind that if you are doing this in your private practice, you are going to have to spend your own money to be able to acquire the certificates to be able to say that you're credentialed to do this. So a couple of them are ACT, so acceptance and commitment therapy, art therapy, biofeedback, coaching, trauma-focused cognitive behavioral therapy, DBT. We have emotional focused therapy, expressive arts therapy, EMDR, which is eye movement desensitization and reprocessing therapy, which is great working with like trauma patients, family systems therapy. There's integrative therapy, interpersonal psychotherapy, reality therapy. Some of these I don't even understand what they would be. Play therapy, if you're working with children, positive psychology, music therapy, narrative therapy, marriage and family therapy. So there's so many. Psychoanalytic therapy, psychodynamic therapy. There are some in there that we might say no to, but what do you want to work with? Because there are people obviously out there that respond to different types of therapy better than others. Once you get all of that, you kind of know what you're specializing in. And then bravo, you can start your own practice. Yay.
That's all it takes.
So this is the last, one of the last things we're talking about, insurance versus private pay. So when we talk about insurance, the good things about insurance, and it's all kind of right here, is it'll bring in a larger amount of referrals quickly because of the credentializing process. So basically what it is to get credentialed to work within an insurance company. I'll kind of run through this because everyone can kind of just read what's on this PowerPoint for themselves, the pros and cons. To get credentialed, you first need to have that tax ID number for when you start your practice. And then also that MPI number if you want to be able to take Medicare or Medicaid patients within that population. Then you also have to have your malpractice insurance. So once that's all set up, then you'll be able to create an account with a particular medical clearinghouse. The ones that they recommend online is something called CAQH. And you can go online and you create an account profile with them. And it's a medical professional clearinghouse. And what it is it's this clearinghouse has associations with all the different insurance companies out there. And then once you're on there, when you contact an insurance company, they can just see your profile. And then companies can also then contact you. So it's a great way to just start. So once you create that profile, you're done. Then it's your turn to just go online or call up different insurance companies and ask if they're accepting new providers. And if they aren't, oh well. If they are, then you'll start the application process to sign up with them. And then once you're applied, then you have to sign a contract for what you're going to get paid per client. So again, this is, you can't bill what you want, like with you were doing it on your own, you're going to get reimbursed for whatever rate and you sign that contract. Then the next thing to think about with insurance is the client portion of everything. So client calls and they want to, you first need to verify their insurance before your intake. And this is to be able to just check and cover to make sure that their plan covers the mental health that you're going to provide. Because a lot of like certain therapies I know with like marriage and family therapy, a lot of those therapies are not covered under insurance. So you want to make sure before you spend all of that time and effort going into it first, that their insurance company is going to be able to handle that. And then you also need to know if they have a deductible or if they're just dealing with a copay. Because if they're dealing with a deductible, they're going to pay you the contracted rate out of pocket until they hit that deductible. If they're just starting with copay, then they're only going to pay that minimal amount, and then you'll be billing the insurance companies for the rest. So you need to know that. You also need to know whom you are going to be sending claims to. A lot of insurance companies, you don't bill directly to the insurance company, you deal with like a second party. So you need to know whom to send them with. And there's a lot of different software programs from reading and everything that are out there that'll kind of help you through the process. So though it sounds scary, and I don't think it's as scary as people think it is. It's more just like a pain in the neck to have to go through all of this to be able to get your money. And then the last part with dealing with clients is before you start everything, do they need a referral? Because if they need a referral from their primary care, you're not going to get paid until you get that referral. So those are just things to consider. So you look on here, these are pro insurance and then con insurance to be able to work with them. It's pretty straightforward. We can go to the next slide for private pay. And it's the exact opposite. Money. So you can charge what you want. There's no delays in getting paid. There's no claims or paperwork. It's appealing to only clients with a higher economic standing, though. Excuse me. I do not have COVID. I have incense burning in my room. So con for private pay is that you will have to work harder, like Kara was saying, to build those referral services. And there's lots of opportunities to work with particular clients that really just want to work with just insurance and not have to pay out of pocket. And then obviously people with lower SES or limited access to services might not be able to see you. So those are some of the pros and cons.
Okay, so just some other things to consider when you think about getting into private practice. Some suggest considering starting out in a group practice so that you're not completely on your own. You still have some people to turn to when you have questions. You don't have as much responsibility for all of the overhead costs. Some people do this part-time while they're still in their agency or hospital job to kind of get started and get their feet wet in this world. Make sure that you get not only a good person to consult with and mentor you in terms of your counseling skills, but also someone to consult with or mentor you in terms of your business skills. There are a lot of business skills that go into this, as you heard from Melissa, that we simply don't learn in our psychology counseling programs. But you need to be a good business owner in order to survive in private practice. As far as liability goes, get a good lawyer on retainer so that if something does happen, heaven forbid, you don't have to scramble finding a lawyer, you already have one. Save up before you start. You'll want to have a financial cushion when you first get started because you're not going to have that same level of financial stability at any point in private practice that you would typically have at an agency as things wax and wane, when clients no-show, when you have less clients, when COVID happens and people freak out and then you need to get telehealth services and all those things. But also when you first start out, you're not going to have a full caseload. So you won't have a full caseload worth of clients paying your new salary. So it's important to have a financial cushion when you start out. And again, remember to save for taxes so that you're not hit with something huge at the end of the year. Someone suggested, another counselor who is in private practice suggested, I would encourage anyone who goes into practice to first interview several individual practice providers and ask them what their nightmares are, as well as what their sunshine days are like. It's important to remember, no matter what we do, we are going to have good days and bad days. And in private practice, those good days and bad days might be even more apparent because we are our source of livelihood in private practice. More than anything, seek out support. Make sure that you're not isolated. Actively seek out support from people who are going to support you emotionally, as well as other people who are in the field. We also recommend that you check out resources like private practice skills. I have them hyperlinked here. I'm not sure if Dr. Valungas is going to be making all of the PowerPoints available, but if not, feel free to reach out to either Melissa or myself on email, and we'll be happy to send it to you. But private practice skills came up multiple times throughout our research, and this is a private practice practitioner who makes short videos about anything and everything related to private practice, down to the minutia of how to set up your office comfortably. And this can help you learn more about skills and considerations that are necessary in private practice. So we have some questions for you to think about. Obviously none of us are planning on jumping into private practice right now. We couldn't even if we wanted to. But when you do start to actively consider this, some things that are important to answer for yourself are, what skills do you already have that would be useful for private practice? Keeping in mind that not only do you need solid clinical skills, but you also need solid business and marketing skills. When you look at this list of skills, what's missing? What skills do you need to learn in order to be able to increase your chances of success in private practice? And in addition, how or where can you learn these skills? When you think about going into private practice, it's important not only to think about what your motivation is, what's your driving force that's going to keep you going on the bad days, but what are some things that would prevent you from pursuing private practice? What are some things that are the turnoffs or the no-goes? Is there anything that you would run into that would cause you to turn around? And lastly, how well would you be able to manage the demands of private practice while maintaining optimal self-care practices right now? If there are any gaps, what would you need to change or learn before you dive into private practice so that you can make sure that you're managing your stress levels, your own life and work balance, and your mental health appropriately so that you can continue to remain a good clinician and just a good human being who's not going crazy? So that's it for us. We've got our sources here also hyperlinked if you want to peruse them. There's some really great information available, but thank you for listening. And for those of us who are planning to go into private practice someday, a very, very preliminary good luck.
Yes. And just one quick thing, Kara, right before we end that I didn't mention is that if you are considering insurance versus private pay, if you wanted to do private pay, but the clients were nervous about it, you can always create something called a super bill, which is where they pay you out of pocket, but then you create basically like an invoice that you can give to them to be able to submit to their insurance. So it's all on them to be able to get reimbursed. And that's always something that you can look into to be able to accrue more clients and have it become a little bit more appealing. So I wanted to just share that last big thing, but thank you so much, everybody. And good luck if you want to be in private practice.
Maybe we'll see you out there.
Yes.